All right, I'll tell you what, we're not going to make you wait another 3 minutes. We are going to get rolling right here. Thank you guys for joining us on our live stream here. My name is Bob Flugfelder. I'm a science educator and a science communicator and also a classroom teacher. So what we're going to be discussing today definitely hits home with me directly. We're going to be talking about all things COVID and masks and all of that in the framework of our children and what their coming weeks and months are going to be like. So we have a great panel that we're going to be introducing in just a second. You will notice we're doing this as a live stream and not as a podcast because we want you guys to get involved as well. We want to hear what your questions are and what your concerns are, and we will put them right to the panelists. If you are watching on YouTube, you can enter it in the comments. If Twitter is how you roll, hashtag advancing recovery with your questions. We have a crack staff of interns that is going to be texting me those questions so that we can ask the panelists all about it in the second half of our session here. We want to let you know that this is being brought to you by the Vaccine and Immunotherapy Center, also known as VIC. They are at advancingcures.org, and also COVID Recovery. They are at covid-recovery.org, two great organizations that are making an awareness and getting the real data out there about COVID and how it impacts all people around the world and especially in the U.S. All right, terrific. We're going to dig right in. We have got a wonderful panel all together here, assembled for you, and I'm going to introduce each one. Up first, we have Patricia Guglietta. She is a primary care pediatrician in Chelsea, Massachusetts. She's worked at the MGH Chelsea Healthcare Center for 20 years and is the coordinator of the Pediatric Refugee and Immigrant Program. And no doubt she has had a busy time from a pediatric standpoint, and I'm sure lots of questions have been coming her way about how what parents should be doing about immunization and masks and all that. So we look forward to talking to you. Also, we have Dr. Philip Chan. He's an associate professor in the Department of Medicine and School of Public Health at Brown University and an infectious disease physician. He also serves as the medical director for the Rhode Island Department of Health Division of Preparedness, Response, Infectious Disease, and EMS. That's quite a business card, sir. So we'll be looking to talk to you, and we're going to get all the latest information and kind of the big picture awareness of what's going on because it's changing almost daily. And we also have Emma Rashis. She is a graduate from Stanford University. She graduated in June. Yay, congratulations. She's got a bachelor's degree in biology. She's going to be back in the fall to get her master's degree. But we're talking to her because she is also a children's author. And she's written a book about vaccines and children called Lily the Llama Helps the Herd. So we're going to be talking to her about that. So we are looking forward to talking to all of you about this, but I think given everything that's been in the news lately, I'm going to start with Dr. Chan. Give us, I know guidelines even came out today, give us kind of the big picture of what the current guidelines are for adults, for sort of our 12 and overs, and then for our youngest kids as they sit today.
Yeah, thank you, Science Bob. So first off, thank you for hosting, and thank you everyone for joining. It's a pleasure to be here. I do want to say that we're, again, not in a great place here in the U.S., and certainly here in New England. I'm here in the state of Rhode Island. A lot of us are seeing our case rates increase, unfortunately, and it's all due to the Delta variant. So the Delta variant is more contagious, more infectious than any other strain we've seen. More than 80% of all the variants, the strains of COVID in the U.S. are due to the Delta variant. We've seen the Delta variant across the world really become the dominant strain, and that's because it's so much more infectious. So at this time, and as of yesterday, the CDC is now recommending that people mask again indoors, vaccinated or unvaccinated. I think that was the big thing that the CDC released yesterday. And the reason for that is we know that the vaccines are effective, and it's recommended that all of us should be vaccinated, 12 and over, at the current time. But the vaccines aren't 100%. And we've seen a number of these breakthrough cases, especially in people that are vaccinated by the Delta variant. And we believe that people, even though they're vaccinated and have the Delta variant, they're not going to get that sick. They're not going to end up in the hospital or die, as a rule of thumb, but they can still potentially spread. And so the CDC is now saying that everyone should mask regardless of vaccination status. Feels like a little bit of a step backwards, but really what we all need to do, and what we're here to talk about tonight, is to get vaccinated.
Sure, and I know you said it feels like a step back. This is pretty much all because of the Delta virus or the Delta strain. Do you think if the Delta strain didn't exist, that we'd be pretty much much further along?
I do, actually. The Delta variant is really that much worse. I mean, even if you think about the original strain and what happened in the summer of 2020, even though, COVID cases were really high in the spring, they bottomed out during the summer. And we see that happen with most respiratory viruses because people are outside. These viruses are all susceptible to UV sunlight, good ventilation. And we're not seeing that this time. And that just speaks to how infectious this Delta variant is. Now, certainly there is a component of people starting to socialize and engage again. But again, Dr. Walensky, head of the CDC, called the Delta variant one of the most infectious respiratory viruses we have. And that's what we're seeing.
And I'll have Dr. Guglietta jump in as well on this. The kind of before the CDC guideline, the American Academy of Pediatrics had a very similar recommendation. And what was their data that they had going forward with that? And what was that recommendation?
So I think that the AAP was sort of a little bit ahead of the CDC in recommending masks, certainly for the fall back to school season. And I think that goes for kids of all ages, vaccinated or unvaccinated. And I think because, I think the AAP is on, perhaps responding to more questions and more concern from parents and pediatricians as to what we're going to try to do to try to stop the spread here in our schools, but also in the greater group.
And what kind of questions are you getting from parents about this? And we assume if you're in a high school, it's possible you could have a classroom where teachers and students are all vaccinated, but they still want the masks on.
I think that's correct, and I think that speaks to what Dr. Chan was saying about the Delta variant and the transmissibility of the Delta variant, where you could be infected with the Delta variant, not be very sick, perhaps not even recognize that you have COVID, but would be able to transmit that to other more susceptible or vulnerable people.
And I guess, Dr. Chan, this is, you could compare this to seatbelts. Like I've heard people say, well, if we are vaccinated, why should we need to be wearing masks? But it's not 100%, and they've never plugged it as 100%. It has a very high percentage gives you a very high percentage of immunity. But as far as seatbelts go, you can't say, well, I've got my seatbelt on, so now I can drive 120 miles down the Massachusetts Turnpike. Is that a fair analogy?
Well, one of the analogies I like to use for both masking and vaccines as well is it's not always about you. So the vaccine will protect you. Remember, the masking will also protect others. So even if you don't think you're at risk, and frankly, younger people tend to be at a lower risk of COVID. That's one silver lining of the pandemic, if there's any. But even if you don't think you're at risk of COVID or need to wear a mask, remember that part of this is doing it for others around you. And we're surrounded daily by people who are more vulnerable, grandparents, a parent, a colleague, a coworker. So even if you don't think you should be vaccinated, perhaps consider it. Perhaps consider masking for those around you who may be more vulnerable.
And right now you can, if you are 12 and over, you can get vaccinated. Have we started getting data in on that age group, sort of the middle school, high school age group, and how the vaccine is working specifically for them?
So that data, the Pfizer vaccine is authorized for individuals age 12 and above. And so the studies that have been done do show that it's effective, it's safe. We haven't seen anything unexpected in that age group. The one thing that we have seen that came out a couple weeks ago is a very small increase in general uh, in mRNA vaccines for people for pericarditis and myocarditis. So very small risk, especially in younger people, very rare with these vaccines to cause pericarditis or myocarditis. Now, all the patients that I've seen in our state who've had that, and it's been very few, they've all done well. People get better, but it is a small risk. But in general, the safety data on these vaccines is excellent. It really is best case. They work, they're effective, minimal side effects, and it's how we're going to end this pandemic.
And what are the what are those diseases that you mentioned? How do they how are they identified?
Yeah, sorry, got a little bit carried away there with doctor talk. But one thing that came out for the last couple of weeks, is that in a very small number of people who get the mRNA vaccine, so that's the Pfizer or the Moderna vaccine, they are at risk of something called myocarditis or pericarditis. And what that means is that there's some irritation of the heart tissue, the heart itself, the lining around it. And we think that exists because the vaccines induce some antibodies that may irritate and target the heart tissue. So anything involving the heart can be serious. Here in our state, we have had a couple of hospitalizations due to that, but people generally do fine. I think the other thing to keep in mind too is that we know through other reports, through data, journals, that people who get COVID have a pretty significant chance actually of having some heart involvement. It's something we've seen and learned during the pandemic is that if you get COVID, and certainly if you get serious COVID, there's a good chance that your heart may be involved. So in general, every single doctor out there, every single major medical society will agree that the benefits of the vaccines outweigh the risks. And in general, the vaccines are incredibly safe.
Excellent. And that's, if you follow the data, that's what we got to do. We got to follow the data. And Dr. Guglielmo, what questions are you getting from parents? What are the big concerns coming to your office? You're at the front lines as a pediatrician with kids. What are concerns do parents have, and maybe even what concerns are you hearing the kids asking? What questions are they asking?
What I would say is that I work in Chelsea, Mass, which was one of the hot spots in Massachusetts, certainly at the beginning and the middle of the pandemic. And our numbers are sadly rising again. So I will say that among my patients, I think a good number of them are vaccinated. The parents are vaccinated and the 12 and ups are vaccinated. And if they are not vaccinated, then we have a discussion about that in the office. And I feel like a lot of the concerns are around the safety of the vaccine. Is the vaccine safe? Are there side effects to the vaccine? I think there are significant concerns about the myocarditis, whether or not that is a minuscule chance. It's still a chance for your individual child. And I think that a lot of parents that I hear are not refusing, but they're more hesitant. They want to wait a little bit for their data. And I feel like I am encouraging people for us all to be vaccinated in the way that Dr. Tran was talking about, in terms of eliminating the disease in our community. And I feel like a lot of it is, there are some fears of microchips or metal in the vaccines, which I'm hoping that I was able to dispel. But I think for the majority of people, they're worried about side effects from the vaccines affecting their individual child.
And what do you tell them when they are concerned about that? Obviously, also it's getting a shot, and we'll talk to Emma in a second about that. If there is a parent out there that is hesitant, what are you telling them?
One of the things that I talk to my patients about is how the pandemic has affected children in the past year in terms of education and social interaction, from the youngest infants to up to high school and college students, have really suffered emotionally, I think, and academically because of the pandemic. And one of the things that I say to people is that I want my kids to be in school, and I want my kids to have an education. I feel like unless we all come together as a community, as a world, and vaccinate ourselves, then that's what we're doing for the big people. And there is a risk. I vaccinated my kids who are both 13 right away. I just feel like I think that it's almost a social responsibility at this point, and I try to talk to my patients about that. But then I do feel like the vaccines are safe, and that the more people that we get vaccinated, the better control we will have over these variants. So I kind of try to take the big picture a little bit about what we're doing for our community and how we're trying to defeat the virus in our community. And that's that we all do our part. And that's sort of how I'm looking at it.
Well, certainly I can concur that the idea of getting back into in-person school will probably be a very big driver, and hopefully that will convince some parents to get them vaccinated once they learn they're safe. We definitely want them back in school because remote learning is no fun. Been there, done that. All right, we're going to get to Emma in just a second. I thought it would be worth talking to Dr. Chan very quickly about boosters. So there's now talk about boosters, I think primarily for the Pfizer. So give us a big picture of how boosters would work and how it might apply to kids as well.
Yeah, great question. So boosters, again, are another exposure of your body, your immune system to an outside element, in this case, COVID. And it's meant to, again, remind your immune system, remind your body that this COVID virus is a danger, and to ramp up your immune system and to be on alert, essentially. And so there's been a lot of discussion about whether or not an additional third shot is needed for the Moderna and the Pfizer vaccines. And I think we'll see what happens. You know, the FDA, the CDC, a group of internationally renowned doctors and scientists will review this. I think the data is pretty compelling for people who are immunocompromised, people whose immune system is not normal for some reason or another. There's good data and science emerging that a third booster shot will increase antibodies and a person's immune system even more if you already have a kind of a deficient immune system. The data on people who are otherwise healthy and have a normal immune systems isn't quite as good. And so we'll see what happens. You know, it may turn out that in the future, we may need a booster dose to, again, prime to re-expose our immune system. So we'll see. I just wanted to follow up too on one thing Dr. Gugliotta mentioned, and that's I have two kids, a 10 and a 14-year-old, and I also had my 14-year-old daughter vaccinated. She wanted to be vaccinated, but I just want to speak to the safety of these vaccines, that they are safe. And of course, I would never do anything to put my own daughter in danger. Never, ever, ever. I love her dearly. But I felt comfortable enough with her getting the Pfizer vaccine when it was authorized for those 12 and older. So just wanted to put that out there, Bob, too, to let viewers know that certainly as a physician and having reviewed the data, that I felt comfortable.
Right. It's in the world of science, we are, and people should know, if you haven't figured out, I'm not an expert on this. I'm learning along with everyone else. But in the world of science, when people ask me, do you believe, I usually respond with, what I believe is actually completely irrelevant. The question is, where is the science taking us? What does the science show? What I believe doesn't really matter when it comes to explaining science. All right, we're going to jump over to Emma now. And Emma, you've got a whole different angle on this. You are a student, and in addition, you have written a book. And tell us a little bit about Lily the Llama and what you, who have no children, inspired you to kind of write this book.
Yeah, first of all, thank you so much for having me on the panel tonight. It's such an honor to be part of this conversation. I wrote this book, Lily the Llama Helps Her Herd, which teaches about herd immunity and the importance of vaccination for elementary school students. The target age is really kindergarten through third grade, and maybe older kids as well, if they might read it to a younger sibling or if they're at that reading level. So I became interested in this project because I, in the early months of the pandemic, I became aware that there was just so much misinformation and negative information about vaccines circulating online and on social media, and really a lack of easily digestible resources targeted at children and families about vaccines. So I was thinking, what sort of role can I play in advocacy, as I understood that getting a vaccine and herd immunity would be our way out from the pandemic and a way to get our communities back together and back to normal times at the end of this. Um, and additionally, I grew up in close proximity to some individuals who were really adamantly against vaccinating themselves and their children, and were really open about that and shared that with me. So it's something I remember from my childhood, talking to my parents and my pediatrician about why we get vaccines. And I think it's really stuck with me that this isn't something that I'm doing every year just for myself, but for my entire community. And that's something that's really important to me. And I don't think something we share often with younger children. Um, and while I started doing research about what type of project I could do, I also learned that the vaccine rates in general for all routine pediatric vaccinations have dropped at an alarming rate throughout the pandemic. And we're putting our communities at risk for serious outbreaks of vaccine preventable disease when we return to in-person school and work. Um, a report from the World Health Organization that came out a couple of weeks ago shared that 23 million children across the world missed out on basic routine vaccinations throughout 2020. So I'm hoping that this project can just play a small role in sharing an easy to read resource for kids and families about why it's important that they get their routine vaccinations, and then also when it's available to kids, that why it's important for them to get a COVID vaccine.
And tell us a little bit about Lily and how you picked a llama. So Lily is hesitant about vaccines, and tell us a little bit about the story.
Yeah, so as I mentioned, what really resonated with me about the importance of vaccines when I was younger was this herd immunity aspect. I didn't know that it was called herd immunity when I was younger. I learned that later in an immunology class when I was in college. Um, but I think that's another piece, that we were using all this terminology that the general public doesn't usually use, and we were just throwing it around on the news and on social media. And it's really important to explain it in an easy to understand way. And I thought, what better way than to use a real herd of animals, like a herd of llamas? And I used anthropomorphism, so the attribution of human characteristics and behaviors to these animals, to also distance the story from any particular culture or group, because this helps the message resonate with a diverse audience, and not just any specific group in our country, because this is something where we all need to work to understand together. So that's how I sort of landed on writing about llamas. And yeah, the story is that Lily has a concern that a lot of kids have going to the pediatrician. She doesn't want to get a vaccine because she's worried it might hurt. And her pediatrician explains how the vaccine can protect her from illness, but also her family, her neighbors, her entire herd. And that message really resonates with Lily. And then she goes home and shares with her family what she learned about vaccines at the pediatrician. So I'm hoping that kids will model this behavior, asking their pediatricians questions when they're worried about something at their appointment, asking about vaccines, and also sharing what they learned about vaccines with their families at home.
Oh, that's awesome. And llamas are adorable. And are llamas actually, is it a herd of llamas? There's so many strange animal herd names.
It is a herd of llamas.
All right, good.
Yes.
And let me, Dr. Gugliotta, how are you finding kids are about vaccines? Kids are generally hesitant about needles in general. How have they been about actually getting the shot?
I think that, because of the way the government has structured the shot distribution, we don't give any COVID shots in my office. They're all given right now at the pharmacy. And I would wish them luck, the pharmacists, to give some of these kids vaccines, because we have a lot of kids who are fearful of vaccines here. There are a lot of tricks that you can use to make vaccines less painful when you give them. And I consider myself to be quite an expert on giving vaccines in a less than terribly painful way, because I work with a lot of refugees who need vaccines on their first visit for arriving to the United States. I think that kids in general are afraid of vaccines, but by the age of 12, if they understand what the vaccine's for, that patients are generally not super anxious about vaccines, and if they are, they've always been, and then we work with them and their parents to sort of educate about why the vaccine is important and what it does, just like the way that Emily's talking about it. And I think that it's just like any vaccine. It's just another vaccine in our armamentarium of vaccines that prevent infectious disease. So to me, it's. I mean, some people are hesitant to get this vaccine, but it's not because of the pain of the vaccine. It's more about the fear of side effects from this particular.
Although it is kind of an interesting point that pediatricians know how to give, we haven't given them to younger kids yet, but pediatricians know how to give shots to young kids in a special way. There's, there's online videos of clever ways that that doctors give shots to very, very young kids. Are we getting close to that, Dr. Chan? Are we getting close to immunizing our youngest kids?
Yeah, great question. And that time can't come soon enough, in my opinion. And the answer is yes. So Pfizer, I think, is the closest along. They've released some statements that suggest that they'll be submitting to the FDA for authorization probably in September. And the FDA has mentioned, and through the CDC and others, that maybe by midwinter, which seems like a while away, but maybe midwinter, we should expect some of these vaccines to be authorized for children under the age of 12. So a little bit of time, but in the near future.
And are side effects the same with our youngest that they're testing on as with adults? How are side effects different between kids and adults on that?
Great question. The studies have shown that largely the side effects are the same. So what you can expect is a sore shoulder. Sometimes people develop a little bit of a fever, general malaise, which just means you don't feel well for a day or two, and then it goes away. Myself, I got the Moderna vaccine back in January, February as a physician. My arm was really sore for a day or two. I felt crummy, got a little bit of a headache, had a low-grade fever, and then I was fine after a day. And that's pretty typical of what people get. And I think one thing to remind people is that these shots are very, do have more side effects than, say, the flu shot. We just, for whatever reason, people's body tends to react a little bit more. So I would just expect to have some mild to moderate symptoms in terms of a sore arm, not feeling well for a day or two, and then you should be fine.
Awesome. All right, we're going to jump in and get to some questions, and our first one is for Dr. Chan. This one I think comes in from YouTube. It's about variants, and obviously we have the Delta variant. Is there anything that can be done to stop the development of more variants? And do we need to worry about more variants? Where sort of are there other variants on the horizon?
Yeah, it's a great question. I think one thing that's reassuring is that we haven't seen large-scale variants. And so what I mean with that, in the flu, for example, is that if you have a virus gene, right, whether it be DNA or RNA, what we're seeing in the COVID virus are little mutations across the genome. What happens in the flu sometimes is that you have entire segments of that gene that changes and switches. And so that would be a concern for COVID if you had large subsets of the virus genome that's kind of switching and changing around, because all of a sudden you essentially have almost brand new viruses. So we have not seen that yet in COVID. That is what we see in the flu. That's why we tend to need a flu shot every year. So it's definitely a different virus. What we're concerned about is that, is that this virus may evolve with mutations, and we may see variants in the future. The Delta variant is by far the worst one that we've seen. It's accumulated a number of these mutations that allow it to overcome, that allow it to just infect people more. So it's definitely a concern. There is a concern for future variants as well. The biggest thing we can do to protect people is to halt transmission. So get vaccinated. The best thing we could do is to get as many people vaccinated as possible and halt the cycle of transmission, halt the virus from being passed from person to person, and increasing the chance that it's going to mutate as it transmits.
Awesome. And we want to thank Christina for that question. All right. And I think I'm going to go over to Emma. And Emma, have you gotten feedback from any of your readers about how the book has maybe helped a little vaccine hesitancy among the youngest kids learning about it? Obviously, they're not taking the vaccine yet, but any feedback yet?
Yeah, it's been really fun to get some nice reviews on Amazon and receive emails from people who have read the book. But what's really meant the most to me is sort of the personal feedback I've received when I was workshopping the book with elementary school students in the earlier stages of the project. I was sort of piloting the book with them to see what they liked, what they might want to change. And in a kindergarten classroom, a student came up to the Zoom camera really close. She was really adorable and said, "I'm so excited to get a COVID shot. I hope that it'll be my turn soon because I want to be like Willie the llama and help my community be safe." And that just really meant a lot to me for a 5-year-old to be saying that she's really excited to get a shot after reading not even the final version of the book. I just thought that was really special, that it's certainly been a really difficult year for kids, but I think they've developed such a sense of the role that they can play in ensuring their own health and the health of their communities. And it's been really cool to see that through talking with them about what they've learned this year and talking with them about vaccines and what they think about COVID. So I've just really enjoyed seeing that and hearing that from some of the younger students that I've worked with.
Excellent, and that is available on Amazon. So if people are interested, we'll see if we can add a link to it in our description after the broadcast. All right, we do.
There also, oh, sorry.
Yeah, go ahead.
I was just going to add, there also are free versions available online, free ebooks in each of the languages that it's translated into. So if you'd like a paperback copy, you can purchase it from Amazon or a Kindle version. But there are also free ebooks available for whoever would like to read it.
Oh, even better. And how people find that?
Those are on Stanford Medicine's Digital Medic website. So you can just Google Lily the Llama Helps Her Herd and it'll come up, or we'll try to share a link afterwards with all the different links to buy the book, to read it for free.
Great, yeah.
What languages you have it translated into, Emma?
It's translated into Spanish and Portuguese.
Great. Thanks.
Awesome. All right, more questions are coming in. Let me see what we have here. This one maybe goes to Dr. Guglietta. We have a question here about what have you found is the biggest motivation factor? And you spoke a little bit about this earlier, but what's the biggest motivation factor about a parent that might be hesitant to saying, let's get them the shot?
I feel like if they can be reassured about the safety, I think just getting back to normal life, and many, if not most of my patients have really struggled with remote learning and have not made gains this year for a variety of reasons. A lot of my patients where I practice have internet problems, connectivity problems, Wi-Fi. They don't have Wi-Fi, they don't have a smartphone, they don't have a laptop. So I feel like when we talk about getting back to normal and wanting, to protect our family members, but also to return to a normal education is really what I'm emphasizing when I talk to them. And then, and I think parents, all of us, want our kids to have the best possible education. So if that's what needs to happen, then I'm hoping that people will agree to vaccinate.
Yeah, I'm also hoping that the fact that we could have our masks off and life kind of got back to normal, and now suddenly they're telling us to get our mask back on, that we're going to be like, all right, let's get that shot. We don't want to go back in that direction. So it's a very hands-on indicator that we're going in the wrong direction. So hopefully that will be a little bit of an incentive as well. All right, I'm going to throw this question out. Perhaps Dr. Chan, this is one for you. Robert from YouTube wants to know, are vaccinated teens at more or less risk of breakthrough infections?
Great question. I'm going to preference that by saying we don't know. We don't know. That being said, I'm going to guess that they're probably at lower risk. And the reason is, and one thing we've learned, is that this virus actually binds to a receptor in the lungs called the ACE2 receptor. Interestingly, that's why people get pneumonia and get sicker in general. It's because this virus actually has a preference for this receptor that's found in the lungs, right? And pneumonia is an infection of the lungs. And so people just get sicker because it's not binding to your throat, it's not binding to your nose as much, or your upper airway. It's really going down deep into your lungs, which is why people get sicker. Again, one of the good things is that we realize that kids have less of this ACE2 receptor in their lungs. And so even though the Delta variant is more infectious, and we are anticipating that kids will get infected less, and especially those that are vaccinated when the time comes, kids under 12, is that they're going to be less susceptible to being infected in general, certainly once they're vaccinated, but also because they have this biological reason that they just have less of these receptors in the lungs. But bottom line is we don't know quite yet.
So more data needs to come in on that. What are your opinions about getting everyone's masks on and even 2-year-olds and up? Do you think a classroom where everyone's masked and unvaccinated, or where everyone's vaccinated and unmasked? Or does it probably we shouldn't even compare those two. But basically, we're at a point where we just need to get the masks back on anytime we're indoors.
Yes, it's a good question. I think to your point about what do we prioritize, there's no doubt in my mind, 1 through 10, that I would prioritize vaccination. Vaccines are effective. They work. We know they do. They're effective against the Delta variants. And then I would consider masking. In terms of whether or not we should mask indoors, I mean, I mask certainly as a healthcare provider. I've always masked, right? When we go see patients with different respiratory infections, we know it works in the healthcare setting. People with the N95s, the special advanced respirators, and certainly with the surgical mask. So I am a proponent of masking. There are people that would say that there is limited data, and that is true. There is limited data in community settings, whether or not masking works for sure. But based on our experiences in the healthcare setting, we know without a doubt that masking does work. And I think as the Delta variant is spreading, as we start going back into school, so indoors in smaller enclosed settings, I just think it makes sense to start being more conservative initially, at least. We could always relax restrictions, but to me it makes sense, at least initially when school starts in September, because the Delta variant is more prominent now, because we're seeing an uptick in cases, to start with masking and kind of go from there.
And I guess we have great data on that because it was almost a non-existent flu season. Everyone was masked and, of course, social distance. So if you compare it to the flu season, it almost didn't exist this year.
Absolutely. Yep, absolutely. That was another thing that came out of the pandemic, is that we saw a decrease in a lot of other respiratory infections. So definitely worked in regard to the flu. Some of us are a little bit more concerned with the Delta variant because it's more infectious, even though we had a lot of successes in the K through 12 setting this past year, 2020, 2021. Some of us are worried that because of the increased infectiousness of the Delta variant, is that we may see it spread a little bit more easily this year in September, which is why, again, I think starting a little bit more conservative with masking makes sense.
Well, we can jump that over to Emma. Emma's getting ready to go back to Stanford. How are you going to be, as far as you know, in person, correct?
Yes, as of right now, we should be having classes in person, but I'm prepared for a reversal of that decision at any time with how things are going.
How are students about masks if they are in person at Stanford?
I'm sorry, I didn't catch that question. Cut out a little bit.
Are students pretty good about putting their masks on campus?
Yes, we had pretty strict guidelines when we were on campus in the spring quarter. So I'm hoping that we'll be following similar guidelines in the fall. I think a lot of students saw it as a privilege to be getting to be at school and have our community together. So we were trying to respect what the university was asking of us and what the county and state restrictions were as well. And I'm sure that we'll be following sort of similar protocols in the fall. Everyone will be required to be vaccinated to go back to school in the fall. But I think we'll just have to see what the actual guidelines will be. But I know for me personally, I'll be bringing my masks back to school. I'll be trying to socialize outside if I am going to see people who I'm not living with outside and distant for now, and just see what happens. But I think we need to take it day by day instead of expecting anything for a few months from now.
Yeah, and who knows? Maybe things will change. We can hope. I know it's tough. It's definitely tough as a teacher, going back in and not being able to see your students' faces. But do what you got to do. We got a question for Dr. Guglietta. As we mentioned, that you can only get vaccines pretty much now in the pharmacy. Have you heard anything about when they will get to be in your office and when you'll be able to administer those?
No, short answer. I think that I think a lot of primary care doctors across the country have been hoping that there would be a way for the vaccines to be distributed at their primary care office. I think there are a lot of logistical difficulties with the Pfizer vaccine, the temperature requirements, and there are some storage requirements that I think make that difficult. I do think if it becomes an issue for young children to get vaccinated, I would expect that we're going to have to rethink that, because it seems unlikely that young children are going to be able to be vaccinated at I feel like that would not be something that would be very for now. I mean, I think we wanted it, but I feel like logistical problems have made it impossible for us to get it.
I know.
In Massachusetts, the governor specifically wanted to make it available at the pharmacies.
I know I spoke to a pediatrician and they had said that they could get it, but the quantity, they'd have to get such a large quantity that they wouldn't logistically be able to administer it and store it and all those other issues. All right, we got another question coming in. And this one is for Dr. Chan. There's a question about hotspots and what, because a lot of times the masking requirements are changing for hotspots. How are hotspots defined?
Yep, it's a great question. So the CDC has put out guidance that looks at the rate of infection. So that's saying how many cases per 100,000 people. And so it's broken down into 4 categories. 10 or less is considered low, 10 to 50 is considered moderate, 50 to 100 is substantial, and above 100 is high. And so the CDC is recommending masking for areas, hotspots that are substantial to high areas. And that's a lot of the U.S., unfortunately, at the moment. And I think it makes sense, right? And I think it also gives us a goal to work towards, reminding us that that masking recommendations and having to mask is not forever. It's until we get the burden of COVID down in the community. So I will say in our state of Rhode Island, we are at the substantial mark. So we are. I'm personally recommending folks to mask, regardless of their vaccination status, while we're in this substantial burden of COVID in the community.
So get your masks on the way to get vaccinated. And our booster, right now is just they're talking about boosters for Pfizer. Is that correct? Or the boosters for others as well? And those are not available yet. That's still just an idea, isn't it?
Correct. So Pfizer is the vaccine company that has the most data and is the furthest along. And so they released a statement this week that said that they're thinking about submitting to the FDA their data on boosters and asking for official authorization to be able to give a booster dose for their vaccine.
All right, and will that help against the variants, or what will the booster be doing for us?
That's a good question. The answer is it could, and I think that that's the exact data and the exact question that the FDA, the CDC will review, and that is the question: is whether or not that third dose will provide some further protection against. And I think the vaccine, the Pfizer vaccine, the Moderna, after 2 doses, is still really good at preventing against severe disease, hospitalization, certainly death. So I think one of the questions that the FDA and CDC are going to look at is whether or not a third dose, a booster dose, will protect against infection in general. And if it does, and if it's significantly more so than 2 doses, then my guess is they will consider it for sure.
I would imagine. All right, Troy, we do have another question coming in. This is also for you, Dr. Chan. Cezana is asking, how is research done conducted to approve for 12 and older? And is it a similar process for the flu, and is it likely to be even a similar process for under 12? What's that process look like?
Yeah, it's a great question. So, I'm reminded too that these vaccines have now been studied for over a year. So the first studies for these vaccines started in July of 2020. So we actually have over a year now of safety data, right? And so the gold standard in studying for these vaccines is what's known as a randomized controlled trial, where you take a group of people, you divide them in 2, you give one of those groups the vaccine, and you give one of the groups the placebo, which means basically a shot of water or whatever you want to give them, but not the vaccine. And then you look at what happens in those 2 groups. And the scientific hypothesis, right, is that people who got the vaccine are going to have much lower rates of COVID. And that's exactly what we found. In the Moderna and the Pfizer, it was a 94, 95% less likely chance of reduction of getting COVID. And so they do those studies, of course, in other age groups, and they've done them now 12 to 17. And then now they're doing them less than 12. And I think one of the key points is, especially for individuals under the age of 12, is that the FDA does ask for more safety data. So they want a little bit of a longer follow-up time to ensure, especially that the vaccine is safe for kids, for those under 12. And I think that that's reasonable and appropriate and makes sense. And I do want to assure people that there were really no steps skipped in the safety process for these vaccines. I think one question we often get is, well, this all happened really fast. All of a sudden these vaccines were authorized and we started using them. But I think this really just speaks to the fact that when you have government and the pharmaceutical companies and the entire scientific community coming together with one goal in mind to get these vaccines done with huge investments, billions and billions of dollars, this is the outcome. We achieve our goals. We developed the vaccine in a timely manner to address this pandemic. So really it's a success attribute to modern science.
And it's not a first that we saw this when Kennedy in 1961 said, we're going to go to the moon by the end of this decade. And suddenly 400,000 people got together, and we went from just having airplanes to landing on the moon. So like you said, you put the resources and the motivation together, and we can do some pretty amazing things. All right, we did have, there's one other question that I wanted to offer up to Dr. Guglietti, and let me just see, hold on, I saw it. Maybe I did not see it. Well, let me ask you, is the vaccine the exact same vaccine for adults as it is for those that are 12, as it will likely be for those that are 4?
My assumption is that it's the same vaccine for 12 and up as it is for adults. Generally speaking, when there's a lower age, for the flu vaccine, initially the infants got a half dose, and now they've actually changed the recommendations, and everyone gets the same dose from a 6-month-old to a 100-year-old person. I did want to make one comment regarding the booster doses and vaccine availability. And one of the things that bothers me as a person that works with a lot of immigrants and refugees is that the worldwide COVID pandemic is not nearly over. And we're so fortunate to be here and to have opportunities to get vaccines. But I would remind everybody that there are still many, many places where there's only 1% of people in the whole country that are vaccinated in other countries. And I would wish that more wealthy countries that have access to vaccines and pharmaceutical companies could be compelled to provide vaccines to people who would otherwise be unable to have them, and that can devastate societies in many, many countries around the world. So I just wanted to have people kind of think about that, because I'm thinking a lot about that.
And tell us a little bit more about what your involvement and what we're doing for refugees in that area.
At Chelsea for the last 20 years, I've been working with patients that are arriving as refugees to the United States. Those are people who've been displaced from their homes by war or famine or other political problems, and that have been approved to come to the United States through the United Nations. And so when I see patients that arrive from other countries, they're generally from war-torn countries like Syria, Afghanistan, Iraq, or countries like Somalia or Nepal or Bhutan, where there are ongoing conflicts. And so public health there is really sort of a different ballgame than it is here. And so when I have a lot of patients who have families and relatives in Brazil and in Central America and in different parts of the world where healthcare is a privilege and not really a right. And so when I think about how lucky we are here to have vaccines and to have them available, and then people to want them, and then I think about people in other countries who I think would be very, very fortunate if they had access to some of the vaccines as easily as we do here.
Yeah, I think we definitely take that for granted. That if we need one, we can get one. I went to Gillette Stadium here and made an appointment, went in, got it, was done, and so much of the Earth's population doesn't have that ability to do that. So recognizing that we are certainly fortunate to do that. We have a question to all panelists, and I guess it's sort of a rapid fire question, if you will. But you might each have sort of your own take on this, and the question has come up kind of a bit, but it'd be interesting to kind of hear the short answer from each one of you. The question is, what do each of the panelists think would help improve the rates of vaccination both in pockets in the U.S. and globally? Who might want to take that one on first? What's your one piece of advice?
I'll start where I think we need to go. So I do think we need to start to mandate vaccines. And I say that with my public health hat on. I think that vaccines have been available to all citizens, residents here in the U.S. For many months now. And I think what we're seeing across the U.S. is a push to mandate them for people that are less enthusiastic about the vaccines. And so I think especially in healthcare settings, I think especially in settings that care for vulnerable, more immunocompromised individuals like healthcare settings, is that we really need to start to mandate them to get vaccine uptake up there.
All right. Who else? What's your angle?
Emma, you want to go?
I can share from sort of an education standpoint. I guess that's where a lot of my research was with developing I think we need more education around vaccines that's culturally sensitive and respects the level of understanding of the communities that we're serving, because I think a lot of communication about vaccines is either very negative and telling people not to get vaccines, or will just be get a vaccine because it's the right thing to do and not explaining it. But that's not how humans work. We don't just do things because we're told. We want to understand why we're going to do something. And so I think it's really important to continue developing resources for communities that are underserved in healthcare, and in this respect, communities that are under-vaccinated, developing resources with them in mind, and in order to create equity in terms of vaccination and increasing the vaccination rates in our country.
And I imagine you would echo that one, Dr. Guglietta.
Yeah, I think Chelsea is a pretty unique place. I was involved in some door-to-door door-knocking activities where some infectious disease and pediatricians from Children's Hospital and MGH went door-to-door with some community health workers from community agency in Chelsea. And we went around and talked to people about the COVID vaccine and were they going to be vaccinated and did they have any questions, and could we get your phone number and we'll sign you up for a vaccine, or we come here at this such and such a time and we'll do vaccines. They have mobile vans for doing vaccines. They have people going to your house to do vaccines. I feel like a lot of the hesitant people, given the opportunity to have a one-on-one conversation with someone, it has been helpful with me in convincing some of my vaccine hesitant families and patients. And I feel like there have been articles in the New York Times about how if someone you trust, if someone that has expertise and that you trust talks to you about the vaccine, you may be more likely to get it. So I certainly agree with Emma, and I think that if we can bring the vaccine back out into the communities to be discussed by people that are, respected and known in individual communities, that would help a lot.
And that certainly is where it comes down to. You talk to people who have made this their life's work, and if you get information, follow your sources and make sure it goes back to a trusted source and a peer-reviewed source. And we're just about out of time, but I think all of us can agree on one thing, and that is that we're going to get back to normal much faster if we just get the shots and help anyone else that we possibly can to get the shots as well, and get our lives back to normal, our masks off, and back to being the America we all know. I see a lot of head nods. Excellent. We're going to have links to Emma's book. We'll have links to the Vaccine Immunotherapy Center and the Advancing Cures out in it. And if you want to keep putting questions in the comments even after the video is over, we'll see if there's a way to get those out as well. But otherwise, see the links that are in the description, and they're all full of information as well. I want to thank all of our panelists for taking their time out. It was so great to get all of your very unique perspectives. Hopefully, we all get our friends and our families vaccinated, and we get back to normal. So thank you, guys. And for those of you that are just joining us, thank you for joining us, and help us spread the word. All right.
Thank you.
That's going to wrap it up. Take care, everyone.
Bye, everyone.